Good morning, everybody. I'm Greg Simon from the Kaiser Permanente Washington Health Research Institute. I'd like to welcome you all back to day 2 of our workshop. We will finish today with 2 sessions. The first of those is the last of our topic focus sessions, focused on the question of inference from observational comparisons. And then we'll finish our meeting hearing perspectives from FDA leadership about the work we've done over the last day and a half and what parts are useful and what parts are not and where we might go from here. To introduce the substantive theme of our first talk today, I'll go back to my sort of Cajun food theme of yesterday morning. And tell you a story about one day when Boudreaux and Thibodeau were out fishing. And as they did when people are fishing, they settled all important questions of philosophy and science. And one of the questions they were discussing was, what is the greatest invention in the history of humanity? So Thibodeau asked Boudreaux, what be the greatest invention? And Boudreaux says, I think that would be the thermos bottle. And Thibodeau says, the thermos bottle, what would be so great about that? And Boudreaux says, you know, if it's duck hunting season and you get up in the morning and you put that hot coffee in the thermos bottle, 2 hours later you're out on the water, it's cold, you open it up, that coffee's still piping hot. But if it's crawfish season and it's hot outside, you put some iced tea in there, you get sweating in the morning, you open it up and it's still cold. Now that is the amazing thing about the thermos bottle. It can do hot and it can do cold, but how do it know? That will be the topic of our first session. Observational comparisons. You might be able to trust them, you might not, but how would you know? So I'll now turn it over to David Martin, who's the Associate Director for Real World Evidence Analytics at FDA, who will give us a more scholarly introduction to this topic.